bringing you the news and information you need from the people making a difference. This is Comcast Newsmakers.
Hi, everyone, and welcome to Comcast Newsmakers. I'm Mark Curtis. We're discussing a very important issue in our communities these days, and that is the state of mental health care. The demand is up, and we're going to tell you where you can get some help. I want to introduce David Rice, who is the CEO and president of the Tri-Valley Community Foundation, an umbrella organization that helps a lot of nonprofits and charities in our communities. And then Cedric Hurskin, who is the chief operating officer of Becton Healthcare Resources, a firm that provides mental health services. Good to see you both today.
Good to see you.
Let's start with you, David, and talk about the demand right now. What are we seeing in terms of the need for mental health services in our communities?
Well, there's an increased need because of the stress of a weakened economy and the things that go with that. And one of the things that we're finding is as we help other organizations, let's say medical clinics and food service programs, we're finding that a lot of people are presenting with mental health issues, and we try to provide funding for wraparound services. So the issue of mental health is growing in the area that we serve, the Tri-Valley area, and we know it's growing throughout the country.
Okay, well, let's bring Cedric into the discussion here. What do you provide in terms of trying to arrange mental health services, and what difficulties are you running into in doing that?
Excellent question. Well, BHR Corporation, this is our 10th year anniversary, and what we do is basically employ psychiatrists and psychologists to deliver mental health care services throughout the Bay Area and, oddly enough, Michigan. As you well know, as David mentioned, mental health is prevalent. Mental illness is prevalent within our communities, and what we do is basically give them first-class treatment, make them feel better, give them a safe haven, and give them the professional services that they need in order to get better.
And I assume that we are seeing more people who haven't had a history of mental health problems, the stress of unemployment,
Correct.
Job loss, trying to figure out how to pay the bills, and a lot of people lose their health insurance too. How do you deal with that?
Well, a number of ways. We actually work with Medi-Cal. We accept Medi-Cal, private pay. Also, your private insurance that you may receive from your employee. If you have the mental health care benefit, you can see us as well. We accept Aetna, Blue Cross, Blue Shield, some of the major healthcare companies out there. So there are a variety of methods in order to get the help. But what I always tell people, no matter what, make sure you get the help because it's an intelligent choice to make.
Yeah, it's it's difficult because historically, mental health care has been, a lot of people feel like, the neglected part of the healthcare system, that there hasn't been adequate access out there.
That's right, and one of the things that we really appreciate about BHR is that not only do they provide these very highly professional services, but they also partner with our community foundation. They're a very giving and sharing company, and they help us to provide services and funding for people in need. One of the things that we make sure that we explain to people is that if they come to our foundation, we'll make sure that they're hooked up with resources that can help them, such as BHR. And we also appeal to the community through workplace campaign funds and year-end annual giving campaigns to raise money to help people who might be financially in need to access those services.
And a lot of those federal workplace campaigns and things are just going to be getting started as we get into the fall part of the year, and it's important that people sign up and give generously if they can.
That's right, and of course, not only will they be receiving help with mental health programs, but also other things that they might need. As I said before, they may need clothing, they may need education for their children that they can't afford. So we provide those kinds of links.
Real quick, we only have 20 seconds left, Cedric, but I assume the mental services are not just for adults, they're for children too.
Correct. Children, adolescents, families. What we do is try to keep communities together.
Okay. Good information. Let me tell folks where they can get more on your website, David, Tri-Valley Community Foundation. It's tvcfoundation.org, and we're going to put a link to BHR on there so folks can find out more about mental health services available in the community. Again, David Rice from the Tri-Valley Community Foundation and Cedric Hurskin from the BHR, Becton Healthcare Resources. Thank you both for being here.
Thank you.
Mark.
Thanks for joining us on with Comcast Newsmakers. I'm Mark Curtis. We'll see you again next time.